Many thanks, Hajara. So it's a long-term impact of COVID-19, and we are going to analyze this now. Joining us in the studio is Dr. Imedim Fon Okon. She's the current chairman, NMA National Committee on Protocols and Programs. Also, apart from being a field epidemiologist, she is also the NCDC Lagos State COVID-19 Rapid Response Team. Glad to have you on the program.
Hi, Millicent. Happy Africa Day.
Thanks. Same to you as well. Talking about the day, let's start with what you think about Africa, if they've been affected differently by the pandemic.
Well, we've not actually been affected differently. What I would just say is that we've had infectious diseases quite a while, and we've had systems in place to manage infectious diseases. So with these systems in place, when we had this COVID-19 come into Africa, it was managed on time with these systems that were already in existence. So I wouldn't say we were affected differently.
In terms of education about what this virus means, have we handled it appropriately? Because we've had several measures put in place to stop misinformation, and there appears to be some people who still don't believe that this virus exists.
A whole lot of work has been done in risk information and communication. But we still have a lot more to do, because just like you rightly mentioned, some people still do not believe that COVID-19 exists. And because of that, they're being a bit careless about these precautionary measures that are being advocated for preventing it. You know, the kind of health systems we have, especially in Africa, our health systems are not that strong. So it's better for us to take precautionary measures rather than wait to come down with the diseases, because we may not be able to handle it because our systems are not that strong.
Some public health physicians say that our infection rates and cases are underreported. Do you agree with this?
Well, underreported because the more you test, the more you're likely to discover. So we've ramped up our testing capacity now, so we're seeing more cases. So I wouldn't say underreporting per se, it's just that if you test more, you'll be able to discover more cases. So we're doing that now, and we're increasing our testing capacity. So we'll definitely see more cases, as it were. We'll be able to discover more cases.
If you compare that with how Nigeria is doing to other countries, say South Africa, the president today said that the outbreak will get worse as soon as they try to ease restrictions, which they're looking forward to. Ghana has imposed a 3-week lockdown and is looking at easing restrictions as well, saying that, you know, the country can't be on lockdown forever. Nigeria has since eased restrictions. We're seeing more cases each day, and we're at par with testing, not testing as much as we should with our population. Are we making progress, or are we retrogressing?
We're not retrogressing. We're definitely making progress. Like I mentioned earlier, as we test more, we're going to definitely discover more cases. But, you know, as we are relaxing this lockdown, it is very important for us to increase sensitization and awareness and let people know the importance of these precautionary measures so that we don't have the surge that everybody is scared of. So that is just the worry about relaxation of the lockdown. Like they mentioned, I think Mauritius also, for about 3 weeks or thereabouts, they've not had any case. Then I think today they had like 2 new cases. So it's not good to relax too much, especially when it comes to these preventive measures. We know that prevention is definitely better and cheaper than cure, so we should emphasize on that.
How much do you think if we learned anything from the Ebola outbreak, and what more do you think we would learn with this pandemic moving forward?
Well, this pandemic, like one of my colleagues mentioned, is a classless disease. COVID-19 is a classless disease. It has affected everyone of different race, religion, tribe, and of course, class too. So it has affected everyone, and there's hardly any nation that has not been affected by this, such that nobody is traveling anywhere for any treatment. All of us are here. So many people by now have discovered the deficiencies in our health system. And I am hoping that moving forward, this is going to improve or strengthen our health system. So at least that would be one positive takeaway from this.
All right, we appreciate your time. Dr. Imedin Fono-Kern, current chairman, NMA National Committee on Protocols and Programs. Thank you for joining us on the program.
Thank you very much, Millicent.